Hi, I'm Jennifer Mapollet at the Body Temple Pilates Studio in Indianapolis, Indiana, and I'm here with my teacher, Mel Mendoza. We are talking about SI joint pain, and that pain may be described as pain in your lower back to one side. Maybe it radiates down to your bottom and into your leg. Perhaps it goes to the front of your hip. So some of the things that you can do to avoid SI joint pain or help alleviate some of that pain are simple exercises you can do at home to create lumbar length, lumbar stability, as well as more space in each SI so that it has more room of free movement for your legs and your lower torso. So we are going to start with having Mel lay down on her back with her arms out to a T. Her legs are started with a long length in her leg, but we're gonna go one leg at a time. So we're gonna start with her left leg. We're gonna bend her left knee in, placing her foot. So I'm gonna look to make sure her hips are even to start with. And I wanna think about her knee tracking over her third toe. And I also want her to engage her hamstring to help lift this hip. So the right leg is long and it's actively pulling out. I'm gonna cue her to take a full breath and begin to curl her left hip up as she tracks that left knee forward. And we're gonna try to think about the breath going down the back side so that her ribs don't twist and turn with her. And then she's gonna think about the side seam of her shirt and the length in her knee as she rolls back down to try to create more length and space than she had before. So we are not only getting mobilization in her spine, but we're also getting a nice little baby rotation to hydrate those joints. And a full breath to roll back down. And then we're gonna switch. So we're gonna extend the left leg long, creating more length, and she probably feels a little bit longer on that side. And then we're gonna bend the right knee, creating more length on the right side, making sure hips are even to start with. And Mel's got a little bit of a tick on the right side today, so we're working on that. And we're gonna pull through the right knee, rolling this hip. And I'm gonna cue her just to breathe a little bit more down in the bottom of her right lower lobe to let that space happen in her thoracic. There we go. And then we're gonna track through and roll back down, creating more space on the right, letting the hip roll down, letting that knee go forward. And one more time, rolling back. Reaching. And then breathing more space, creating more space in the fingertips too. Good. So we never want to end on a unilateral movement, so we'll go right into pelvic press. So we're going to bend both legs in. You can also set a ball between the knees if you're severely aggravated in your SIs. It will just help to unload some of that pressure to help you squeeze into. I want her knees to track. I'm going to back her feet up a little bit closer. So we're going to think about pulling the knees forward as she pelvic tilts back to her waistband, evenly rolling up both sides. And then a full breath to reach out through the back of the legs to help guide the spine back down. Good. One more time. Full breath to curl, scooping back, letting the bottom ribs open. And a full breath to stretch out to help guide the spine longer than it was before. Then we're going to go all the way up into pelvic press. So we're going to take a full breath to roll back through the waist. Keep tracking those knees, utilizing your hamstrings, so draw the weight out and over your feet. And we're gonna initialize the hamstrings a little bit more by flexing the feet back. And then she's gonna try to activate her hamstrings more to pull forward, and she's probably cramping. And we're gonna roll down, slow, one bone at a time. Good. And you're gonna keep trying to pull those knees over that toe and drag the heels towards you. All the way down to a heavy tailbone and equal hips. And that is pelvic press.